Hello everyone, this is Gary Anderson. Hope you all doing well. In today's video, I'll be talking about type 2 diabetes. So if you like a video related to my health, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Type 2 diabetes. Type 2 diabetes is an impairment in the way the body regulates and uses sugar glucose as a fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar level can lead to disorder of the circulatory, nervous, and immune system. In type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into your cells, and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult onset diabetes, but both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise are not enough to manage your blood sugar, you may also need diabetes medication or insulin therapy. Now, products and services. So, signs and symptoms and type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infection, numbness or tingling in the hand or feet, areas of darkened skin, usually in the armpit and neck. So the causes of type 2 diabetes. Type 2 diabetes is primarily the result of two interrelated problems. Cells in muscle, fat, and the liver become resistant to insulin because these cells don't interact in a normal way with insulin. They don't take in enough sugar. The pancreas is unable to produce enough insulin to manage blood sugar level. Exactly why this happens is unknown, but being overweight and inactive are key contributing factors. So how insulin works? Insulin is a hormone that comes from the gland situated behind and below the stomach. Insulin regulates how the body uses sugar in the following ways. Sugar in the bloodstream triggers the pancreas to secrete insulin. Insulin circulates in the bloodstream, enabling sugar to enter your cell. The amount of sugar in your bloodstream drops. In response to this drop, the pancreas releases less insulin. The role of glucose. Glucose, sugar, is the main source of energy for the cells that make up muscle and other tissues. The use and regulation of glucose includes the following. Glucose comes from two major sources: food and your liver. Glucose is absorbed into the bloodstream where it enters cell with the help of insulin. Your liver store and make glucose. When your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. In type 2 diabetes, this process doesn't work well. Instead of moving into your cells, sugars build up in your bloodstream. As blood sugar level increase, the insulin producing beta cell and the pancreas release more insulin. Eventually, these cells become impaired and can't make enough insulin to meet the body demand. In the less common type 1 diabetes, the immune system mistakenly destroy the beta cell, leaving the body with little to no insulin. Now, what are the risk factors? Factors that may increase your risk of type 2 diabetes include weight. Being overweight or obese is a main risk. Fat distribution, storing fat mainly in your abdomen, rather than your hips and thighs indicates a greater risk. Your risk of type 2 diabetes rises if you're a man with a waist circumference about 40 inches, 1.6 centimeter, or a woman with a measurement about 35 inches. In activity, the less active you are, the greater your risk. Physical activity helps control your weight, uses up glucose as energy, and makes your cell more sensitive to insulin. Family history. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes. Race and ethnicity. Although it's unclear why people of certain races and ethnicities, including Black, Hispanic, Native American, and Asian people and Pacific Islander, are more likely to develop type 2 diabetes than white people. Or blood lipid level and increased risk is associated with low level of high density lipoprotein, cholesterol, the good cholesterol, and high level of triglycerides. Age. The risk of type 2 diabetes increases as you get older, especially after age 45. Prediabetes. Prediabetes is a condition in which your blood sugar level is higher than normal but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Pregnancy related risk. Your risk of developing type 2 diabetes increases if you developed gestational diabetes when you were pregnant, or if you have gave birth to a baby weighing more than 9 pounds 4 kilograms. Polycystic ovary syndrome. Heavy Polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, excess hair growth, and obesity, increases the risk of diabetes. Areas of darkened skin, usually in the armpit and neck. This condition often indicates insulin resistance. So the complications. Type 2 diabetes affect many major organs, including your heart, blood vessel, nerve, eye, and kidney. Also, factors that increase the risk of diabetes are risk factors for other serious chronic disease. Managing diabetes and controlling your blood sugar can lower your risk for these complications or coexisting condition. Potential complication of diabetes and frequent comorbidities include heart and blood vessel disease. Diabetes is associated with an increased risk of heart disease, stroke, high blood pressure, and narrowing of blood vessel. Nerve damage in limbs. High blood sugar over time can damage your destroy nerves, resulting in tingling, numbness, burning, pain, or eventual loss of feeling that usually begins at the tip of the toes or fingers and gradually spreads upward. Other nerve damage to nerves of the heart can contribute to irregular heart rhythm. Nerve damage in the digestive system can cause a problem with nausea, vomiting, diarrhea, or constipation. For men, nerve damage may cause erectile dysfunction. Kidney disease. The diabetes may lead to chronic kidney disease or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. Eye damage. Diabetes increases the risk of serious eye disease such as cataract and glaucoma, and may damage the blood vessel of the retina, potentially leading to blindness. Skin conditions. Diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. Slow healing. Left untreated, cuts and blisters can become serious infection which may heal poorly. Severe damage might require 2-foot or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. It's not clear whether treating sleep apnea improves blood sugar control. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorder that can cause dementia. Poor control of blood sugar level is linked to more rapid decline in memory and other thinking skill. Now, what are the preventions? Healthy lifestyle choices can help prevent type 2 diabetes, and that's true even if you have biological relatives living with diabetes. If you received a diagnosis of pre-diabetes, lifestyle changes may slow or stop the progression to diabetes. Now, a healthy lifestyle includes eating healthy food, choose food lower in fat and calories and higher in fiber, focus on fruit, vegetables, and whole grains, getting active, aim for 150 or more minutes a week of moderate to vigorous aerobic activity such as a brisk walk, bicycling, running, or swimming. Losing weight. Losing a modest amount of weight weight, and keeping it off can delay the progression from pre-diabetes to type 2 diabetes. If you have pre-diabetes, losing 7% to 10% of your body weight can reduce the risk of diabetes. So that's all about the diabetes in this video. I hope you all liked it. So before signing off, I would like to request you all, please to like, share, subscribe this video with your loved ones so that they will get to know better. So this is Carrie and signing off. We will definitely meet in the next video with my other content. Till then, God bless you. Bye bye and take care.